Okay, I'm recording.
All right. Good evening. This is Erica Iheme with Jobs to Move America, and we're here today to talk about workplace safety and rights during COVID for Alabama workers. Thank you for joining us. So today we'll be having several presenters. We have Kameron Dawson, who's a staff attorney at Better Balance, and we have Feroza Freeland, who's a policy associate at Better Balance. And I'm Erica Iheme, Southern Director to Jobs to Move America. And we'll also have a piece presented by Patricia Todd, who's the Policy Manager here at Jobs to Move America. This training is brought to you in partnership by Alabama Coalition for Community Benefits, Adelante Workers Center of Alabama, A Better Balance, the AFL-CIO, Jobs to Move America, and the National Black Worker Center. I'm now going to pass it to Kameron, who's going to talk you through what are your rights in the workplace.
Thank you so much, Erica. And we're so happy that you're able to either watch this training at home or be a part of our webinar today. And before we begin, I just want to say a little bit about A Better Balance and what we do. So we're a legal advocacy organization, and our southern office is located right in Nashville, Tennessee, so not that far from Alabama. But we do provide know your rights information to all southern workers, and we try to use the leverage of the law so that workers can care for themselves and their loved ones without risking their economic security. You know, many times we find that on the day-to-day, workers are left with the hard choice to choose their health or to choose their paycheck, and that shouldn't be the case. So at A Better Balance, we try to prioritize, along with paid family and medical leave, the priorities you see here. So pregnancy accommodations, how to fight against pregnancy discrimination. If you're a worker who is curious about their lactation rights or, you know, even their rights while they're caring for elderly family members or children, as well as paid sick time, predictable and flexible scheduling, and defending local democracy, which you'll learn more about from Feroza later today. And with that being said, I just think the goals for today's training or workshop is so that you'll learn the laws that protect you while you're caring for your own health, especially during this time of COVID, but we'll also talk about more permanent laws that are in place. And then if you're caring for your loved ones, how to use the laws to address potential workplace issues, and also where to go if you have, you know, general questions, not just if you think your rights are being violated, but if you just have more questions after listening to this webinar. You know, where can you go for resources that are free as well as confidential, and you know, where you can go to find support during this hard time that everyone is navigating right now. And so there's a whole host of employment laws out there that we could cover, and this is just sort of a short, narrow scope of what we're going to talk about today. So, you know, I've organize them into permanent laws that are in place, that have been in place for years and are still going to be in place after this year. And that includes the Fair Labor Standards Act, the Pregnancy Discrimination Act, as well as we'll talk about accommodations if you have a disability or long-lasting conditions from COVID or a high-risk condition. And we'll also get into medical leave, whether that be paid or unpaid options, and where to go if you have concerns about the safety of your workplace, the Occupational Safety and Health Act specifically. And another bucket here are emergency laws that are set to expire at various points in 2020. Some are expiring at the end of this month. But we do feel like it's important for you to know your rights because you're still able to take that time off or use those laws until the end of December. And as a reminder, this webinar is meant to provide legal information, but it does not constitute legal advice. So if you do have questions or are looking for legal advice, we'll definitely give you the number to our free and confidential helpline, which is 1-833-NEED-ABB, but we'll also have, online resources linked below as well. So as we go through these laws, it's very important to know that some of them are fact specific, but we are going to try to make them simple and easy to understand. But here's just a scenario to kind of set the tone for what laws or accommodations might be available for workers in Alabama. So for example, Anna is an employee and her job recently reopened due to the pandemic, but her healthcare provider has advised her to self-quarantine because they fear that she may have been exposed to someone with COVID-19 and she's currently exhibiting symptoms. So right now, Anna needs to take leave, but she wants to return to her job eventually. And so she's curious to know, how can she receive income while she is not working, while she's safely quarantining? And this is something that we hear time and time again from our free and confidential helpline. And we often help workers go through the process of requesting this with their employer. So one possible option for Anna is this new law that was sparked by COVID-19. It's called the Families First Coronavirus Response Act, or the FFCRA. So for the first time in the history of the United States, there's been some sort of national paid leave and paid sick time law that applies to certain employers, and it only applies for COVID-related needs. So this law does provide paid leave up to a worker's full rate of pay, but it does sunset at the end of December on the 31st of this year. So currently, there is a wider push to expand these laws to cover more workers for a longer period of time and to go well within 2021. And so Feroza is going to tell you more about that movement later on, but I'll just tell you right now, what's inside that law and how you can use it if you are covered. So who exactly is covered by this law? Certain employers with 500 or less employees total, or a public agency, and that's regardless of size. So if you work for the county level, or if you know a family member who works for the city, then this law does apply to them regardless of their size. But a worker like Anna, who works for a company, would only be covered under the FFCRA if that company had less than 500 workers total. So this means that a lot of workers are not included within this law to get paid emergency sick time or paid family leave. For example, healthcare providers or emergency responders may not be covered. Now, there is a narrow definition of who has to provide care or what type of healthcare workers are covered. And we can definitely let you know if you have a family member or a friend who may be a healthcare worker and need assistance with this law while they're quarantining. But there also means that workers who work at a job that has more than 500 employees may not be covered by the FFCRA. So we'll talk about what options may be available in those cases. Small business employees may be excluded just for a narrow purpose. If they have a child whose school or daycare has closed because of COVID and they need to take emergency sick time, or if they need emergency family leave, then if they work at a business with less than 50 employees, they may be excluded. But if they work at a small business and they need to quarantine for themselves or to go get tested, then they can still be covered under the FFCRA to get this emergency sick time. And so what exactly are the COVID-19 related reasons? So if Anna is working for a business that has less than 500 employees and she's not a healthcare provider or an emergency responder, then she is covered under the FFCRA to take up to 80 hours or 2 weeks of emergency paid sick leave. And that would be at her full rate of pay or minimum wage, whichever is higher, to take this time off to care for herself if she's been advised by a healthcare provider to self-quarantine due to COVID concerns, if she's exhibiting COVID-19 symptoms and seeking a medical diagnosis, she can take that time off and receive pay. And this is regardless of whether that test comes back negative or positive for COVID. She can also use emergency sick leave if she's quarantining or under a stay-at-home order, or if she needs to care for someone else that is living with her or that receives her care, like a spouse or a parent, and they themselves are under a quarantine order. Now, the last reason too is that if Anna had a child whose school or daycare was closed due to COVID, and she was not able to work or telework because of it. So many times over the summer, we saw that daycares were closed due to COVID, and even now in the fall and holiday months, schools are closing or only having virtual options. So in those instances, emergency paid sick time may be available just in case you're not able to work because you are caring for your child during their virtual learning. And what else? There's also paid family leave that can last up to 12 weeks. Specifically if you have a child whose school is either gone virtual or has completely closed due to COVID-19. Now, if you're not able to arrange a teleworking schedule, or maybe you've gone to a part-time schedule in order to care for your child while they're out, then you can take this emergency family leave, still receive your full rate of pay, still receive 2/3 of your pay, and take that time off to help your child with school, care for them while their health is recovering. But there are some requirements for that time off. So along with your company having to be under 500 employees, you also have to have worked on your job for about 30 days in order to qualify for the emergency paid family leave. Now, this is a little bit different from FMLA or the Family and Medical Leave Act, but it does allow you to take up to 12 weeks of emergency paid family leave if your child's school or daycare has specifically closed due to COVID. And this covers a child who's under 18 and unable to care for themselves while they're at home. And then it also includes not just biological children, but those who are adopted, stepchildren, or those children who you are standing in the place of a parent for, or what we call in loco parentis. So again, if you have any questions about whether you're covered under the FFCRA, or whether, you have questions about how to talk to your boss about the FFCRA, you can definitely give our helpline a call, and we'll, try to walk you through whether or not you might be eligible or how to talk to your boss about these laws. And this law is ending at the end of December, but if you feel as though your rights have been violated, or you may have been retaliated against for asking about these laws, you can still advocate for yourself and enforce these laws up way past December 31st. So this law does apply to not just full-time employees either. It does apply to part-time employees, though it's at a prorated amount of time. So instead of 80 hours, it might be the normal set of hours that you usually work within a 2-week period, or if your schedule is a little irregular, it may be the average within a 6-month period. And then also, if you're self-employed or an independent contractor and you're not classified as an employee, you can still receive tax credits for, the time that you're not able to work or telework because of COVID-related reasons. So this is just a little chart. I figure it is a little bit easier to read with how much you can make under these emergency pay laws. And so you could see there are some caps with paid sick time. So if you're eligible for the FFCRA, you can make up to 80 hours of your full rate of pay, up to $511 per day. And that's if you need to quarantine because your healthcare provider advised you to, or you're going to go get tested after having experienced symptoms of COVID. And again, just to repeat that, emergency family leave, that is at 2/3 of your wages. So the caps there are a little bit different as well. It's about $200 per day. And it all depends on your normal rate of pay, but we do have some guidance on how to talk to your employer about this. And, especially in this day and age with the pandemic, we recognize that this paid leave is a first step to guaranteeing, that workers can care for themselves and make sure that they're still able to take care of their families financially. And so here, I'll just talk a little bit about, if you're not covered under the FFCRA, and definitely that leave is paid for by the federal government. So whatever wages your employer provides you, they receive refundable tax credits from the federal government to refund them those qualified wages. But in the case that you're maybe working at a job that has more than 500 employees, or maybe you have used up all of your 80 hours of FFCRA already, and you don't have any more vacation time or PTO time, you may be able to take unpaid time off under the Family and Medical Leave Act if you do qualify. So under this law, and this is a federal law that does not expire, it's not sunsetting at the end of December. If you have a serious health condition, or you're caring for a loved one who has a serious medical need, then you can take up to 12 weeks of job protected unpaid time off. And that's either all at once or, on an intermittent basis. So if you need a day or two off every week, or a couple of hours every week to go to appointments, you can use that FMLA time off to keep your job and keep your benefits, but also, making sure that you're taking care of your health. So one thing I do want to note is that this FMLA leave is going to run the same as the FFCRA emergency family leave for school closures. So that means if you've taken 3 to 4 weeks, or even the full 12 weeks of emergency family leave under the FFCRA, because your child's school may be closed during the summer, that time does count against your 12 weeks of family and medical leave. However, we have seen through our helpline that many employers are more generous. They do give additional leave through personal leave policies or through the Americans with Disabilities Act, so that, if you find that you need more time off because you need to quarantine again, or because your child's school has gone out again, then you can request that time through these other laws and see if you can work out an arrangement with your employer. I will say, though, many employees are not covered under the FMLA because they do have to meet these 3 requirements here. So unlike the FFCRA, where you only have to work 30 days on the job and work for an employer that has less than 500 employees, in order to meet the FMLA, you do have to work about 1,250 hours in the year prior. So that's usually full-time or part-time workers, depending on how many hours you've worked in that last year. And you do have to work at the job for at least a year. And finally, if your place has about 50 or more employees within a 75-mile radius, then once all those requirements are met, you may be eligible for FMLA. And your employer, sometimes you can ask about family and medical leave or job protected leave, and your employer can let you know how much time you have left so that you don't go over that 12-week allotment. And this is job protected. So although it's unpaid, you may be able to keep your health benefits and keep your job position so that when you do return to work, you're placed at either your same or similar job position, or else it might be a violation of the law there. And oftentimes workers may use unemployment benefits or PTO or vacation leave to sort of make up for that lost income. Okay, and so that leads me right to our next resource for help here. Especially during the pandemic, we have seen new benefits come in unemployment, although some of them are expiring. I think it's good to let you all know, what is out there and what assistance you can apply for if you need to. So here's another scenario. We'll start with Gloria. So she was let go from her job along with several of her coworkers during the pandemic, and she wanted to know, what rights does she have to unemployment insurance? And so before the pandemic, there used to be, 3 main requirements for receiving unemployment compensation. But through the CARES Act, there have been 3 new temporary programs to supplement states' unemployment assistance programs. So that way, the requirements are expanded. So depending on the circumstances, a worker could be entitled to either regular unemployment compensation with a few boosts from the federal CARES Act, or they could be eligible for pandemic unemployment assistance. And one of those programs did expire earlier this summer, and it did grant additional $600 on top of state benefits, but there are still programs for expanding the amount of time a worker could receive state benefits to, up to 13 weeks in addition to regular benefits, or 39 weeks total. And so we are still seeing as well a new push for expanding these unemployment benefits for workers during the pandemic. And you could find a list of these resources on our website at www.abetterbalance.org/COVID-19. So just to visualize, what options might be available for Alabama workers. So there is, normally through the Alabama Department of Labor's website, there is a portal to apply if you have either had a reduction in your hours due to COVID, or you have been terminated from your job or laid off. And so if you're not eligible for FFCRA benefits, that's the emergency sick time or the emergency family leave benefits, you could apply for unemployment assistance. Alabama benefits are typically, there may be a wait in processing time, but if you're able to work and willing to work, and then also you have a certain amount of wages, then you could qualify for Alabama benefits. And then the 13 weeks is an extension of those Alabama benefits. It's a program called the PEUC. So that's one of the CARES Act programs that does not expire until later this year. So if you're not eligible for Alabama benefits, whether it be because you have not worked long enough, or there may not be a qualifying reason, or maybe you're an independent contractor, then you could apply through the Alabama website for what's called the Pandemic Unemployment Assistance Program. And so this program is specifically for those who are not eligible for regular benefits. And it does provide 39 weeks of financial assistance. And this does apply retroactively. So anytime between January 27th to December 31st, you could receive these benefits for, but you would want to make sure that you include documentation of the COVID-related reason and apply through the website there. And so if you're still able to continue working, but some workers we've heard through our helpline are still suffering from long-term health illness after coming into contact with COVID, or they themselves are concerned about contracting COVID if they have severe asthma or high blood pressure, or other conditions that might make them at higher risk for severe illness or death. So here's just a list of laws that could work to give accommodations in those cases, and they would keep you on the job with minor changes. So here's the scenario of David. He has severe respiratory issues and is nervous about his health during this crisis and staying safe at work. And so what changes could he ask for in order to stay healthy while working, but also to keep his job and protection from retaliation? So if he has severe health issues that may qualify as a disability. Now, the Americans with Disabilities Act, it actually does define a disability as an impairment that substantially limits a major life activity. So this does include, walking, talking, breathing, major bodily functions. And so, if he has talked with his doctor and these conditions qualify to the level of disability, and he works for a job with just 15 or more employees, then he has the right to receive a reasonable accommodation, so long as that change in his job doesn't impose an undue hardship. And that means, it's not too difficult for the job to do, or it's not too expensive for his employer to provide. And it's all dependent on the facility, the type of work he does, and some other factors. So in order to start this process of finding an accommodation, typically the first step is just to tell your employer that there's a need for an adjustment, or you could say a change at work for a reason related to a medical condition. So there's no need to say, I need a reasonable accommodation, or under the ADA, I can request this. It's just plain English can be fine. And I do understand, we often hear from our helpline that it's hard to bring up sensitive topics to supervisors or managers, but especially if that the benefits coordinator or the HR or even a union rep that can speak on your behalf, as long as you provide that information that the change is related to a medical need, it is confidential information, and that does kickstart the ADA process, which is protected under the law. And oftentimes, a doctor's note is not needed to ask or request for an accommodation, but your employer may ask for one just to confirm that the medical condition does exist and is confirmed as a disability. Now, one thing too is to avoid sort of vague terms in these doctor's notes. So, light duty, or some things that may not necessarily fit in your job description, but it's good to be as specific as possible and really, talk with your doctor or healthcare provider about what you've seen other people do and what your job is capable of doing. So that way they know specifically what you can and cannot do at work, and they're not able to say, you no longer are able to do the job. And so your employer doesn't have to provide the exact accommodation that you request initially, but they do have to continue a conversation with you. They have to try to give you an alternative accommodation that still will meet your necessary needs. And, if they're not able to provide that accommodation you request, then it is worth pushing back to see, does it even impose this undue hardship, or is it even that expensive or too difficult to do? Because again, that is one of the only ways they can deny that accommodation. So, again, feel free to sort of contact our helpline or our online form if you think you may have a disability, or you think you may be receiving pushback from your employer while you're requesting these accommodations. Because sometimes we can talk through, what your legal options are, or, what accommodations you might be able to do at your job. And, one of our main priorities is also making sure that pregnant workers have the right to accommodations in the workplace and aren't facing pregnancy discrimination. And, this pandemic has really shown time and time again that research is really developing, and we're learning more about this disease and its effect on pregnant people. And more recently, the CDC had added pregnancy to the list of conditions that put people with COVID-19 at an increased risk of severe illness and hospitalization. And they noted that, with this risk of COVID-19, especially for pregnant people, there is an increased risk of ICU admission or the need for mechanical ventilation. And so there really is a need for individualized accommodations that fit the need to each pregnant person as they continue to work and as they continue to care for their families. And this is further supported by the American College of Obstetricians and Gynecologists, who do encourage, pregnant people to know about their rights and the ways to prevent infection, whether that be, maintaining their prenatal care appointments, limiting the risk of exposure to those with COVID or who might be suspected of COVID, and making sure that they are wearing a mask and PPE at work and in public. And so we believe, you should be able to continue working until you feel comfortable or you feel that your health is at risk, and you should be able to request accommodations at your job. And so here are some of the laws, along with the CDC's guidance, that if you or a family member or loved one are pregnant at work and maybe fearing that they're going through pregnancy discrimination or being unfairly treated, they could use these laws to sort of request accommodations or to stop the negative treatment. So in Alabama, the main law that does cover pregnant workers is the Pregnancy Discrimination Act. And so like the Americans with Disabilities Act, this law applies for those who work at a job with 15 or more employees. And it does provide, for workers to be treated similarly to those who are not pregnant. And so here you could see that if you are trying to request reasonable accommodations, whether while you're pregnant or you're recovering from childbirth or you have a related medical condition, even lactation or expressing milk at work, you can use this law to request an accommodation even if you don't have a disability that's associated with your pregnancy. So oftentimes, gestational diabetes or high blood pressure or preeclampsia are some conditions that qualify as a disability under the Americans with Disabilities Act. But if you find that you're still having a healthy pregnancy and you just want to protect your health, you can still use the Pregnancy Discrimination Act to try to request accommodations. And a few things we just say to look out for is to look at how other workers are being treated at your job. Are there any policies that provide for light duty assignments? If there's an on-the-job injury, well, if there are, then it's likely that your employer needs to provide you with similar accommodations. Because if they refuse to provide you with accommodations, in that case, it could be a violation of the law. And that would be something that you might need to talk with an attorney with, or, definitely feel free to call our helpline to see if you need to be connected with resources. And so the Pregnancy Discrimination Act, it also protects against pregnancy discrimination and being treated differently. So if you see that your hours may be cut or you're being harassed because you are pregnant, or your boss thinks that you're not able to work because you're pregnant, then that could also be a form of pregnancy discrimination. And so you want to again see, have other workers been treated the same as you, or is this just a singling out of you and other pregnant workers? And oftentimes it is good to collect policies or handbooks to see, what do these policies say, and is it against the law? And so even if you're not pregnant, or if you're still caring for someone who is in your family or who, may be an elderly loved one that you need to watch out for because they are at high risk, then caregiver discrimination is also protected under Title VII. And that's another permanent federal law that covers workplaces with 15 or more employees. And so the main law there says that your job cannot discriminate against you based on sex, which includes gender roles and sex stereotyping. So because you're caring for a family member, then that does not allow your job to make assumptions about your work capabilities. They can't assume that because you have a child in daycare that you're no longer making your work your priority, and so they need to lay you off, for example. That would be, an example of sex discrimination and likely, covered under the federal law. And just going back to related medical conditions, if you are, pregnant or have just recently given birth and have returned to work, but are still needing time to express milk or still needing reasonable space, then the main law that would cover you would be the ACA. And so that law does make sure that, the Affordable Cares Act makes sure that you have reasonable break time and space to express milk for 1 year after your child's birth. And this law does apply to any job that's covered under the Fair Labor Standards Act. And so, if you're working for a company that, has 500 or 600 employees and they're not giving you space to express milk at work, that is not a bathroom or that is not sanitary or free from intrusion, then you may have a possible violation of the federal law there. And, you may be able to enforce your rights there. And the law also does provide reasonable unpaid break time to express milk. So this often depends on the individualized needs of each mother. And, oftentimes reasonable can be determined by your doctor or after working with your employer to see, if you can take breaks along with your lunch break or throughout the day. And sometimes, especially if your job already provides you with paid breaks, to smoke or to take a rest break, then you can use those same breaks to receive pay while you're expressing milk. And so most of these laws are overseen by a federal agency, whether that is the Equal Employment Opportunity Commission when it comes to discrimination laws, or the Department of Labor on the federal level when it comes to breastfeeding laws. And one other law, especially as we hear time and time again, that workplaces are not keeping up with sanitization or they're not keeping up with social distancing guidance, is the Occupational Safety and Health Administration. And, there is a general duty for all workplaces to make sure that their space for their workers is reasonably free of known health and safety hazards. And this does include COVID-19, this includes public health emergencies and sanitization requirements. So along with that, you also, as a worker, must receive information and training about these job hazards. So, if you find that your job is not taking reasonable steps to lower the risk of COVID exposure, or if they are not providing you with protective equipment, such as masks or plexiglass barriers or gloves, then you may be able to anonymously file a concern with OSHA, and they will begin an investigation to make sure that your job is taking corrective steps. And I also want to note that while many of these sanitizing chemicals are very strong, and there may not be proper ventilation or equipment for workers who are using them, OSHA also does have standards to prevent the emission of hazardous fumes that might be more hazardous to employees. And so if you find that, there's not proper ventilation, or your employer is trying to cut corners, or there could be options that are less hazardous, then you could also use OSHA to advocate for yourself and other workers. And so where do you go? So there are two options. OSHA is a federal agency, and so you can go to the website there and report to the federal level. But OSHA also has two Alabama offices in the area, one in Mobile and one in Birmingham. And so, along with trying to file a confidential complaint, we do often hear that many workers are afraid of retaliation, or their employer finding out that they have filed a complaint or tracking it down to them. And I think it's important to note that not only is the initial complaint confidential and a protected activity, it is also against the law for your job or employer or supervisor to fire or demote you because you have submitted a complaint. So sometimes it doesn't look necessarily like the next day you're fired or demoted, but if you believe that 2 weeks or so have passed and you're starting to face retaliation, then you can file what's called a whistleblower complaint with OSHA or the one of the two area offices, and you can file that within 30 days of what you think might be the retaliating action, and that would cover your possible claims there. But they do, we often say it's good to sort of talk with your supervisor or manager first, advise them of what research you've done and what the law is, and then if they don't take those corrective steps, then maybe make a complaint. But definitely keep documents, keep notes of when you talk to who, and the best thing is a paper trail so that you sort of keep the evidence and keep track of what was said. So we've covered a lot. There's a lot of laws, and sometimes it is confusing to keep them all straight. But one thing we do have on our website at abetterbalance.org are these fact sheets. Whether you're pregnant and wondering when do you need to talk to your employer about your pregnancy, or your need for accommodations, or your need for maternity leave, we sort of have all those dates and what to say listed out in these fact sheets, and they are state specific. So you can find your state and what the laws are, and it's summarized in these fact sheets already. And feel free to print them out or to send them to your friends or family if you think they have questions. But we also cover needing to breastfeed, express milk at work, and we also cover your rights to during COVID-19, whether that be temporary accommodations, or how to communicate the tax credits, or the amount of pay you should receive under the FFCRA. So I want to hand it over now to my colleague Feroza to talk more about how do we build upon the existing laws and actually strengthen current laws, or create new laws that will protect all workers in Alabama.
Thank you so much, Kameron. Hi, everyone. My name is Feroza Freeland. I'm a policy associate with A Better Balance in our regional Southern office. So now that Kameron has given us such a great overview of all the different laws that are in place, I just wanted to take a few minutes to talk about a few opportunities to strengthen protections for working families in Alabama. So first, I wanted to give a brief update on what in the world is going on in Congress around a new COVID relief bill. So as folks have probably seen in the news and read about, negotiations in Congress are ongoing for another COVID relief package. So, all of this stuff is sort of moving as we speak, and it's subject to change. But right now, we think that the latest proposal includes increased unemployment money. We're hearing maybe $300 a week compared to the previous $600 a week. Some aid for businesses and for state and local governments, and some funding to help distribute vaccines. So far, the latest proposals do not include an extension of the emergency paid leave protections that Kameron mentioned, which expire at the end of this month, which that's a really big deal, right, for a lot of working families. And so A Better Balance is really advocating for folks to reach out to your representatives and encourage them to include paid leave in the next COVID relief bill. So you can visit our website. We have a really simple and fast way that y'all can get in touch with your representatives about that. So the next thing that we wanted to talk about is strengthening protections for pregnant workers. So as you can see here in this map, there are 30 states and 5 cities across the country that have passed what we call pregnant workers fairness laws. Basically, what this does is it requires employers to provide reasonable accommodations for pregnant workers if they need it to stay safe and healthy and continue working and earning a paycheck to support their families. So when we say reasonable accommodations, we mean things like having extra breaks, having a stool to sit on, maybe temporary limits on heavy lifting, protective equipment, things like that. And so there actually is a campaign that we are working on with some folks in Alabama right now to enact similar legislation in Alabama. So I encourage folks, if y'all are interested in getting more involved with that, feel free to reach out to me. We would love to connect with you. Specifically, if you've had any personal experiences with pregnancy discrimination on the job. The next thing that we'll talk about is paid sick leave. I think that everyone on this call probably agrees that it's really, really critical for folks to be able to have paid time off when they need to take care of themselves or a loved one, if they need to recover from an illness or seek medical care. But we know that far too many workers in the South and in Alabama don't have access to any paid sick leave at all. And, while Kameron mentioned the really great emergency paid leave protections under the FFCRA, we actually know that over 900,000 Alabama workers are not covered by that. So, this is an opportunity that Alabama could take action. You can see here that 13 states across the country so far require paid sick leave. So this is sort of a growing movement across the country to make sure that folks have that leave when they need it. And the next issue is sort of related. It's paid family and medical leave. So this would be a longer term leave if you need like a few weeks off. For example, if you're caring for a new child, or if you have a family member who has cancer or going through a serious surgery, or if you're dealing with a serious illness yourself, paid family and medical leave would allow you to have that time to care for yourself, to care for your loved ones. You don't have to worry about risking your paycheck or risking all of your savings and not being able to make ends meet. Again, this is something that's not only positive for workers and their families, but also for businesses. And it makes sense, right? If workers feel like they're being taken care of and their needs are being met, they're going to be more likely to return back to that employer. They're going to be more productive. And that's what the data really shows as well about all of these policies. So again, 9 states and Washington, D.C. have passed paid family and medical leave laws. So this is also a growing trend across the country. And also there are efforts at the federal level as well. And the last thing that I wanted to talk about is this issue of strengthening local democracy. And this is something that y'all in Alabama may be familiar with, but there's been this growing trend over the past few years, not just in Alabama, it's happening all across the South and really all across the country, for state lawmakers to pass laws that really tie the hands of local leaders on all kinds of issues. So I think maybe one of the better known cases in Alabama was around the minimum wage. Birmingham tried to raise their minimum wage in their city, and the state essentially passed a law saying, no, you can't do that. But, on things from paid leave to affordable housing to fair scheduling, local leaders in Alabama are not able to take action on any of those issues and to make the decisions that are best for their communities. And again, this is part of a broader trend. It's often driven by corporate special interest groups that really want to prevent any type of worker-friendly policies. So, we believe that it's really important for local governments to have that freedom to make the decisions that are best for their communities. So A Better Balance advocates on that issue as well. So before I wrap up, I just wanted to share, we may have skipped one slide here. Thank you. Yeah, so I just wanted to share really quickly how to get involved with advocacy before I turn it over to Patricia. Because I know it's like you can understand all these great policies and what we need to do, but sometimes it's kind of scary to think about, well, how do I even get involved with something like that? One thing I would say is that sharing your personal story can be really, really powerful, especially with elected officials and people in power. It's really important for them to hear from folks who are on the ground about what you're experiencing and the problems that you're seeing in your communities and what you think the solutions are. Encourage folks to get to know your elected representatives and meet with them, communicate with them about what's important to you. And you can also use the media as a tool, right? So anyone can write a letter to the editor to your local newspaper, and that helps bring a lot of public awareness to the issues that you care about. So the last thing that I'll just say, if folks are passionate about these issues that we've talked about here today, we've made a lot of progress. There's a lot more opportunities for progress to be made. So I encourage folks to follow A Better Balance on our social media and our website. But with that, I will turn it over to Patricia.
Well, thank you for this great information. My name is Patricia Todd. I'm the Southern Policy Director for Jobs to Move America, and I served 12 years in the Alabama House of Representatives on the Education Budget Committee, where I learned, well, you'd think I would learn a lot about economic tax incentives, but in fact, what I learned is there's a lack of transparency and accountability in these incentives provided to manufacturers who are either moving or expanding in the state. If you work for a car manufacturer, let me tell you that all the car manufacturers in Alabama received a lot of money in economic tax incentives to set up business in Alabama. And we don't know really if there's a return on investment. Alabama has given over $5 billion to companies to relocate or expand in Alabama. That's a lot of money that could have been used for everything from public health to public safety to expanding healthcare coverage, making sure our schools are effective in making sure our kids are ready for work. But the fact is that we really don't know the impact of these incentives. None of the incentives require paying a living wage or any workplace protection. In fact, of the incentives that do have a wage floor, they're usually $10 an hour. And we know that is not a living wage, that you cannot support a family making $10 an hour. You can't even do that making, $13 an hour, which is where a lot of these manufacturers start income. And then they charge employees for part of their health insurance coverage. So we're very concerned about that. You will see Jobs to Move America and other organizations in the state advocate for more accountability and transparency in these incentives. As a legislator, even serving on a budget committee, I didn't know how much we gave away every year and what the return on investment was. And when I asked for that information, I was told it was proprietary and confidential. This is your money that they're using to lure these businesses to Alabama. And they're big amounts of money that are giving. Mercedes is one of the biggest economic tax incentive packages that we've given to a manufacturer. That, for example, the state purchased the land that Mercedes sits on, and for $30 million or something like that, and they lease it back to Mercedes for about $100 a year. Many of these manufacturers have not paid a penny in Alabama taxes, which, you know, if you look at our statistics in the state, we have low education attainment. We have a high poverty rate, high poverty rate. We did not expand Medicaid. We have a broken prison system. And meanwhile, we continue to hand out millions of dollars in economic tax incentives to profitable corporations. So you'll be hearing more about that in the next year or two as we begin to develop an advocacy campaign and introduce legislation to assure taxpayers know what we're giving away, and that legislators know what we're giving away. I was appalled when I served on the committee that most of my peers did not have a clue of what kind of incentives we provided. They had, no idea who got what. A lot of these are tax abatements, so it reduces their tax liability in the state, which means the state doesn't collect really enough money to address the critical problems we have in Alabama. So that's just a brief overview. We'll be coming out with a briefing paper in January or February that takes a deeper dive into this. We'll hope you pay attention to this and talk to your elected officials about why there needs to be more accountability and transparency in these tax incentives. So thank you all so much.
All right, thank you for the presenters for the presentation. So if you see on your screen, there are several resources that are available for you if you feel like you've ran into any of these issues in your workplace. We're really appreciative of all of our partners who've contributed to making this training happen today. We look forward to making more trainings like this available. And we have a few more minutes. Before we go, are there any questions that you guys have that might be relevant to this topic that maybe Kameron or Patricia or Feroza could answer? Feel free to drop them in the Q&A box on your screen, and we'll try to answer as many as we can before we conclude.
And before we go to questions, I just want to say too, thank you so much to Jobs to Move America and Erica and Patricia. You all have been such great pioneers in this work, and to our other partners in this project. If you have seen this webinar and are interested in any of the work that we do, please feel free to join and research. And especially if you're wanting to join advocacy work, it really is. We all make it so easy to follow and brush up on these issues. So thanks again.
All right, so we don't have any new questions in our queue. If you're interested in learning what are your other rights in Alabama, of course, we're working to continue to expand these rights. But if you're curious on what your rights are right now, feel free to go to alabamaworkers.org and be sure to check out abetterbalance.org if you're interested in learning more about your rights in the workplace. Again, thank you for your time. All right, we got a question right before we go. I work for Hyundai Plant, and I'm very interested in learning more about the CARES Act money, amount, and etc.
And that's a great, oh, go ahead.
Yeah, go ahead, Kameron.
No, I think it's It's a complex law, and the CARES Act does provide also, I think there were small business loans as well as paycheck protection loan programs that businesses could apply for in addition to the unemployment benefits. And we can definitely, if you'd like to send us an email or join the website, then we can definitely kind of give you the specific information on the CARES Act and maybe how that will go into next year.
Thank you, Kameron. And we're really hoping that our Congress comes to some type of decisions on the follow-up package as well, recognizing that the longer we take to come to some type of decision, the further that our citizens are falling behind in our needs. Also, there's information on betterbalance.org that talks about new languages that's coming through as far as a new stimulus package. So, continue to go to the websites and continue to look at the information. We'll try to keep you updated as best as we can, because the truth is when the last package went through, a lot of people didn't know all of the rights that came with it. People really just were paying attention to the stimulus check, but there are also so many other things that people could have benefited from in that first package. So we want to make sure that you understand all of your rights under the new act that comes through.
Right. And if you still think that, whether you may have been eligible for unemployment benefits earlier in April, or, even in these next few weeks of December, or even if you might be eligible for, emergency sick time or family leave, you can still apply for those benefits. And the December 31st deadline will not sort of cap your benefits there. But you just want to make sure that if you do request any information, it is within that time frame.
All right. Well, thank you for that question. Let me make sure we don't have any more before we conclude. All right, got it. Well, thank you guys so much for your time. We appreciate the time tonight, and we look forward to doing future trainings in the new year. We're looking forward to doing wage per hour trainings. We're looking forward to doing workplace discrimination, but also how do you build worker power in the workplace? It's very important that you understand that you do have rights to in your workplace to not only form a union, but to participate in concerted activities. So when we come back next year, we'll be teaching you about that, as well as giving you more worker safety trainings in Alabama. So again, thank you for all of the presenters, and thank you for the participants who joined tonight. We look forward to seeing you guys all in the future. Thank you and have a good night.